I'm John Batchelor. This is the John Batchelor Show. Larry Kudlow of CNBC's Kudlow Report continues with me, and Kudlow Radio on the weekend. When we're very pleased to be joined by Dr. Scott Atlas, who is professor and chief of Neuroradiology at Stanford University until 2012's Medical Center. He's now a Hoover Fellow, a senior fellow at the Hoover Institution, writing about medical care. Dr. Atlas, from his profile, you can see, is a specialist from a school of specialists in a world of specialists. And if I read, Scott, a very good evening to you. If I read your most recent essay about specialists, you believe that the Affordable Care Act has made specialists put them at risk because of its emphasis, exaggerated emphasis on the primary care, and because it doesn't take into account that the genius of American medical profession is specialists, is the technology. Good evening to you, Scott.
Good evening. Thanks for having me, John.
And the question of specialists, what does the Affordable Care Act not see about the medical practice in America?
Well, I think that the Affordable Care Act and the administration have an outmoded or really naive view of what medical care is, with their emphasis and even talk about how we need more and more primary care, because the fact is, as you mentioned, that it's the specialists and specialty care that has revolutionized the quality of life and the survival from diseases that we've come to know over the past half century. So, in short, what the Affordable Care Act does is a couple things. First, it builds on this shift of payments. The government's Medicare Payment Advisory Commission has recommended substantial cuts to specialists, which are equivalent to a 50% decrease after a decade, because of its emphasis on primary care. And the Affordable Care Act establishes something called the Independent Payment Advisory Board, which reduces payments to doctors and is almost certainly, I think it's a given, going to target things like medical technology, specialty care, and medical imaging. And then third part of this is that there is this tax that we have come to know about medical devices from the Affordable Care Act that is on a significant tax that is not only decreasing jobs and expansion of jobs by these companies, but will limit the access to these very important devices.
Scott, let's talk about IPAB for a minute, this Payments Advisory Board, which I see as really one of the worst aspects of this whole story. And they are going to deliberately, if I read this right, they're going to deliberately ration care along the lines that you described, which is going to cut a lot of specialists out, or at least the reimbursement rates will be so low, or they just may disallow it as something that is insurable. Is that basically the root of all evil here, IPAB?
Well, the IPAB is one of the few things that I think most Democrats and Republicans, if they really were looking at this bill, would agree on. And even Howard Dean was quoted in the Wall Street Journal in a piece he wrote as saying that the IPAB is essentially a healthcare rationing body that needs to go. But it doesn't explicitly ration care, and this is the defense by the Obama administration. In fact, the words are you can't ration care in the law, essentially. But what the IPAB does is it has the directive of capping medical expenditures. And when you cut medical expenditures so that the prices are so low, no one's going to offer those procedures and tests, and so therefore it's indirectly going to ration care. I mean, I think it's kind of unconscionable to deny that, and it's very reminiscent in a way of what happens in the United Kingdom, which we already know occupies a very significant part of President Obama's heart. He's talked about how great it is, because they have a rationing body, the NICE board, that is very similar. In an attempt to reduce costs, it limits the care given. And this is, of course, it is a way to reduce costs, but this is not, I don't think, what the American people would want.
So, just to get this right, the Payment Advisory Board is going to say to the insurance companies, either no, we don't want you to do this at all, or the reimbursement rate will be so low as to render it ineffective, that in effect the insurance companies won't go there. just like in the case of a lot of doctors, a lot of primary care doctors, but they're going to tell you, my hip replacement, my back, only this time it's going to be even more specialized. Is that the mechanism by which this is going to work?
Well, the mechanism isn't as specific as that. The Independent Payment Advisory Board is more of a cap on larger cost issues. But what it does is going to cap the so-called expensive medicine, which are the procedures and the surgical treatments and the medical devices and imaging. I mean, this is another symptom, really, of something much bigger, which the Obamacare, the basis of Obamacare is, which is this shift into government as the insurer. Okay, because when government is the insurer, like we see with Medicaid, they restrict in a very explicit way the available drugs, the available treatments, the available diagnostic tests. And this is exactly why people with Medicaid have worse outcomes than those with private insurance, even the ones with the same diseases and the same socioeconomic status. And they have worse outcomes even than sometimes than people with no insurance at all, because they restrict the availability of care. And this is also why doctors refuse Medicaid more and more. So when government is the insurer, there is a necessary restriction. This is all part of this equation of a shift toward government insurance, a restriction of the availability of care.
Dr. Atlas, is the effect of this going to keep people from becoming specialists because there's no profit in it, because their salaries are limited, and so the investment is not valued?
Absolutely true. And I think this is something that has gone unstated and unrecognized, is that there is going to be this dumbing down of medical care. And what I mean by that are, besides these restrictions on specialist care, on technology-driven care, which is safer, more accurate, and better, there's also going to be, I mean, the fact of the matter is there's a less of an incentive to go into medicine. And I think that, I think it's really sad if we start saying that the government should restrict the salaries of doctors in a very kind of gross way like that, because all that's going to do is to discourage very smart, very ambitious people from going into medicine, not just because of the salaries, but because people go into medical care partly because of the interest and availability of innovation and using new technology to help patients. When you start making the system kind of excluding that part of medical care, it's really misguided, and it's going to end up with a very low technology system if it's allowed to be brought.
And I also understand that many of the health care plans offered by the Affordable Care Act are not pointing people towards medical centers, the high end, where the technicians are, where the specialists are. They're pointing them towards community hospitals, which is worthwhile. But in a way, there's a disincentive to go to the medical centers where there's lots of teaching hospitals.
Well, it's not just a disincentive. There's actually, this is one of the things, again, that's a problem with Obama's exchanges. Because even if you are getting insurance through the exchanges, when you talk about comparable policies, well, one of the things that these insurance policies are on the exchanges are coverage that is limited and excludes the best hospitals and the best doctors. And so you get an insurance policy, okay, you stamp someone as insured, like they do with people with Medicaid, stamp someone as insured, but the coverage, even though it says it's for these diseases, restricts where you can go. So there's actually reduced choice of doctor care and hospital care, and reduced choices of policies in general on the exchanges.
And the insurance companies are doing the same thing. They're being forced to.
Well, the insurance companies, they're dealing with these restrictions and regulations from Obamacare, including the minimum loss ratio, which basically is essentially price setting on the insurance itself. It's not bad enough that the government is fixing the prices on the medical care. Now they're also involved in fixing the prices on the insurance policies.
So they are narrowing the networks of doctors and hospitals, the only way they can survive.
Well, they're absolutely narrowing it, but this is what happens when you have these hyper-regulated exchanges. We know in the private sector where there have been exchanges developed for insurance, and there is actually wider choice without these regulations, people like them. Americans sign up for these, and they're very happy with them, and they actually reduce costs.
Your specialty was neuroradiology. Does that go away under the Affordable Care Act? It just withers?
I don't know if it goes away, but I can tell you that as more and more people with a very naive view of the importance of technology and medical imaging get involved in restricting access to things, and they start lowering the reimbursement rates for things that are so integral to patient care now, like MRI as the kind of poster child of this, you're going to see less and less availability. You can't just say, the price of an MRI, okay, let's cut it down to $100, let's cut it down to $50. Eventually, the good is not provided. We know this. This is nothing that needs to be reproven. Goes back decades about price fixing.
Right, fix the price of bread and bread will disappear. That's what happens.
That's right. I mean, we lived through it in the 70s with prices of gasoline.
Dr. Scott Atlas of the Hoover Institution, he's the David and Joan Traitel Senior Fellow. He was the head of neuroradiology, the chief of neuroradiology for many years at Stanford University Medical Center, one of the best teaching centers on the planet, and we hope it prospers into the future. Larry Kudlow, my colleague and co-host of Kudlow Reports at CNBC and Kudlow Radio on the Weekend. I'm John Batchelor.